All right. Hey, Dave, what's up?
Good morning.
Good to
I'm
see
just
you.
excited for another social hour. We've got some crazy windy weather where I'm at, but at least there's no snow. So,
Where are you at? Oh, you're still Mount Shasta area?
hmm
Okay.
yeah. Yeah, I decided to brave the weather up here and it's been fun. It's been exciting, but I'm constantly watching the forecast to see, what's coming in next. But it
Hey,
hasn't been too bad.
well, one thing that I noticed, because I don't know if you do this when I'm watching people on like work Zooms or Teams meetings, I'm kind of like, oh, that's what they have in their background, this and that. Well, I see a little Valentine's balloon. You have a special someone, or is that from your mom?
It's for my mom.
Oh, gotta get it to
It's
her.
for my mom and it- something happened in shipping. It made it back to me, and yeah, that's the story. So
Okay, I think we have to talk a little bit offline, Dave.
we'll talk offline. Sure,
Uh,
there's
well,
always
we
things to talk about offline.
hey, Lori, our friend Lori Harmillo from Colorado, she's with us. Hey, Lori.
I love.
Um, it's probably, I'm guessing it's springy out there because it's springy over here, and I think we tend to have similar weather, Colorado and Utah, northern Utah. So hopefully it's feeling good. But I hear in the Utah area, northern Utah area, we're gonna get the cold, a shift to the coldness once again with some moisture. But I'm okay with it. What's it like out there, Dave? You said windy right now?
Yeah, windy. We were supposed to get snow, but I think that's gotten delayed a couple days. So I don't know. Probably what's it, Wednesday, maybe tomorrow or Friday, we might get. On the forecast, it says 6 to 12 inches, which I'm not really excited about, but we'll see. It could
Yeah,
change too. Sometimes it just is a little bit more wet and it doesn't really stick as much.
yeah.
So,
Well, last week I've been in the office one day the last 3 weeks, and that is probably a record since like pre-COVID for me.
nice. Yeah. Are other people showing up there in the office? Is it?
Yeah, just different little things happening. Last week, I can't remember the last two, but last week, or sorry, the first two, but the last week was the National Advisory Board in Salt Lake for their first meeting. We posted about that on LinkedIn and Instagram yesterday. But so we had the almost the whole group in town, and it's so fun. It's just great to have them here and get to know new people and
That's a
hear
whole
about
new
the
batch.
initiatives. What's that?
A whole new batch.
Whole new batch.
So
Yep.
all new people. A lot of them getting to see probably the home office for, I say the home office, but our
Yeah.
national office for the first time and probably walking in there and feeling like it maybe is a bit of a ghost town, but maybe that's how it is everywhere. I don't know, post COVID. So,
Yeah.
but there are always, it seems like fun things that our HR staff is trying to do in the office, especially when people come into town.
Yep. Yep. For sure. And I know it's kind of magical for members to come into the national office just to see, I don't know, coding stuff like this. It just is a cool place, and um, we love to show it around. But
Yeah.
I think when you work there, right, anywhere you work, you're kind of like, oh, it's just another place I go to. But when you're an AAPC member, I think it has a magical feel to it.
Yeah, for sure. It's always cool to see, kind of behind the scenes or how things, you're part of an organization that's literally tied directly to your career
Oh yeah,
and we love that close relationship with you just as much as you enjoy it with us. If that, I don't know,
yeah,
makes sense or doesn't sound weird, but that's what it's about. It's about having that close relationship. So I think it's really cool when people get to even sit down with like Bevan, the CEO of
oh
our
yeah,
company. And our company has grown so much over the past even 5, 6 years. Just it's just blown up.
yeah,
But that shouldn't make it any less approachable because you're all members of this, I mean,
yeah,
organization. So
yeah.
we're all kind of in the same boat. We just kind of have different roles in it. So
That office exists because of them.
exactly.
We are here because of you, our members.
It's like the White House. Like we pay taxes, right?
Yeah, yeah.
So, I don't know.
There you go.
I'll see if they can
Hey,
transport that on a couple big trailers over to, to Northern California. And
that's right.
I'm just gonna stop right there.
No, hey, um, we have Mary Lady from Omaha. Mary, you see, we had dinner in Las Vegas at HealthCon. I think she won. She's one of our winners of one of our prizes we had. But it's good to see you with us, Mary. Will you be
Hi,
in
Mary.
Orlando? Dave and I will be in Orlando in a few weeks. Let us know if you'll be there. I think we're 3, 4 weeks out or so.
Yeah, April 4th through the 10th. So I guess those of you that are thinking about it or considering it, there's still time to get your um, conference enrollment, and
Yep.
then still time to arrange travel and everything like
Yeah.
that. Or even get your employer to, help you pay for it as well. So, which is something we always encourage.
Oh,
But
for
there's still
sure.
time if you're thinking about it, come out to Orlando. I'm getting more and more excited about it because I've never been. I know a lot of staff has, and I've been involved with conferences for so long, but
Yeah.
I've always just missed Orlando until now. So
Yep.
I'm pumped.
We have, let's see, Mary is coming. So she says that is correct and yes. And then Lady Martinez says she can't wait to see us in Orlando. We'll say hi to you, Lady, if you say hi to us. She's like, come and say hi to me. So whoever finds each other first, gotta um, say say hello. And then Gabriela Flores from Salt Lake, our chapter officer out here at our Salt Lake chapter says hello from Salt Lake, and we hope to see you in Orlando as well. And we've got a great show today, Dave. We've got Missy Kirshner
Yeah.
and
Angie
Angela
Clements.
Clements. Yep, a former NAB member with a new NAB member, so that'll be exciting. We'll get them on in just a second. And then we've got Melinda Craig. Um, she wrote an article about coding quality. We'll dive into, but I'm going to bring in um, Angela and Missy right now. And
The
I've
dynamic,
invited what's that?
I just call them the dynamic duo.
That Yeah, I'm kind of curious about how they connected. Hey guys,
Hey, how are you?
great. How are you?
Doing well.
Hey, Dave and I were just talking about you guys. Dave called you the dynamic duo, and I mentioned how Angela, you were on the NAB 2 boards ago, I believe,
I think it was
something like
back
that.
in like 2013 through 2018 or something. So
Yeah. And then Missy, you are currently just newly appointed and just kicking off your tenure with the National Advisory Board. So we've
Yep.
got the previous and current. Um, and I didn't know you guys were buddies because you're writing articles together. So I'm assuming you guys are friends. How did you guys meet and make this connection that led to your article about global surgery coding?
Through conference, actually. I met Angie at conference when she was on the NAB back in 2013, 2014. So, a lot of my really good friends are people who I met from going to conference and networking with folks at conference. It's one of the reasons that I love going to conference because you get to meet everybody. You get to meet cool people like Angie.
Yeah.
yeah,
Right.
are cool people like Missy.
Right. Well,
Um,
I called you the dynamic duo because the two of you seem like you're just involved in a lot of different parts, even of our organization. You help out. Well, I'll let you kind of explain the different areas that you're involved just directly with the AAPC.
well, we're both built instructors.
Mhm.
So we see each other with team calls there. We actually share a TA right now. And
Oh, nice.
we actually put this article together while we were both sitting on the AAPC Subject Matter Expert Advisory Committee. So that's where we partnered up to do this.
Yeah.
Okay.
And we're both functioning as chapter officers, both involved with the NAB either before or now. AAPC
Okay.
is important to my career. AAPC is important to what I do every day. And I love to be able to give back to everybody who's newly coming into the organization or who's been here for a while.
Yeah.
I echo that.
Yeah, well, you sure do. And, just even knowing, being involved in the built program with the two of you from the beginning, basically, you were two of our really early instructors when we kind of piloted that program. And it's been so fun watching that grow and, the two of you being a big part of that and being able to help other instructors and, yeah, just very, both great assets to the
It's
industry.
really rewarding to help other students who want to come into the career that we love. It's exciting when you have former students who connect with you on LinkedIn and you see that they get jobs or they email you and like, hey, I passed my CPC exam or I got a job. And it's just really rewarding to be that mentor. And then, sometimes some of the students are just really overachievers and they're great and they end up being mentors to you in some ways, they give back.
Absolutely.
I love it. I love it. Hey guys, let's talk a little bit about your article. It's on page 26 of the March edition of AAPC, the magazine. What, give us a little summary about it and then what you think coders should know from that. Just a few bullets from that.
You go.
So there's a really big focus right now. There always has been a focus, but now it's becoming something underneath the microscope for the OIG in terms of how we bill for surgical services and how we handle these global surgery procedures. So the fact that the OIG came out with kind of something that was on their work plan, we thought that it was important to get that in front of our coders to make sure that we're doing things correctly and appropriately.
Yeah, and we definitely want to get the message out there on what's included in a global period and what's not included in a global period. Because I know from an auditing standpoint, it's kind of fun and you get a little chuckle sometimes when you see a provider who's truly performing a post-op visit, yet they're going to put the diagnoses of a bunch of chronic conditions and try and throw the modifier 24 on it just because they have different diagnoses, even though when you read the note, they don't discuss any of the chronic conditions. The hospitalists may be following for that, and they just want to be able to bill for it, so they put different diagnoses on it. Or when there's complications during a global period, and it's the patient doesn't have to go back to the OR. That's also included in your global period. You can only charge once they go back to the OR, and then you have to put your modifiers that are appropriate for that on it.
Okay. There's a table in the article that's showing Medicare, how they classify global surgery based on numbers of days, post-op days. Is that pretty typical? Has that changed much?
The number of days has not changed much. I think what happens sometimes is we're not always aware of it or we don't always go back and reference it. There have been some changes with some of our codes that used to have larger global periods that have changed now. The abdominal surgery, some of the abdominal hernia codes changed about a year ago, and those global periods changed. So it is important that it's something that we reference when we are billing and when we are putting our coding in to make sure that we're coding appropriately and accurately. There was something else I was going to say as Angie was talking, and then I lost it. It happens.
Well, and sometimes you do have to watch the insurance as well, because by standard, your global periods are going to be 0, 10, and 90. But shockingly, we actually have a insurance in Louisiana that does not use the 90-day global period. They go with the 45-day global period, which is great for providers because it's not as long and they can start billing for those services. So you do have to watch for those one-offs. It is a rarity, but they do exist out there.
I think the other thing that we see with the global periods is that the providers don't necessarily bill for those post-op surgery days, the 99024, which is important. We need to let our carriers know that we are seeing our patients for a post-op day. And even though it's a zero charge visit, those zero charge visits are important because that goes into the amount of work that the providers are still doing for their surgical services. and it tells them how much work. If we're never billing those global surgery or those post-op days after the fact, then the insurance company kind of assumes it's a one and done and it's a really easy procedure. And they're going to start knocking down reimbursement because you're not doing any work after the fact.
Right, because they value the codes based on the different types of surgeries, and this surgery may require only one post-op visit, whereas this one might require 3 post-op visits. And that's what I think providers miss out on, is because they see it as, oh, I'm doing an E&M and I'm not getting reimbursement. But the way the RVUs are valued for surgery is it includes that pre-op visit, it includes the work done for the procedure, and an X number of post-op days depending on the surgery. And so they only physically see the reimbursement from the surgery code, but there is additional revenue that's built into that code based on those post-op visits.
So it's more bundled into that surgery code is what you're saying.
Right.
And they're concerned. Are they overcoding in some cases where they're like, oh, I need to then add this on because it was just the surgery that was this code? Is that happening, or is that what that was meant to avoid?
I think you see that a lot probably with license of adhesions. A lot of the providers want a code for license of adhesions. One, especially, it takes them 2 hours additional to complete it. But when you look at the NCCI manual, no matter how you slice and dice it, license of adhesions is part of the integral part of the procedure, because you have to license those adhesions to get to the area you need to be able to perform the surgery. And so that's where it comes in. You can bill with the modifier 22 if you have the documentation, as opposed to being able to bill the additional code.
And that's also where we see providers, as Angie was saying at the beginning, we see providers billing those E&Ms with these off-the-wall diagnoses or these completely different diagnoses, just trying to get it through to be paid. And it's already included in what you've been paid for the surgical service. So it's an education piece for the providers as well.
Another big one that you see too is if they schedule a surgery, an elective surgery, and they schedule it a little out, they'll bring that patient back to do the official H&P that the hospital requires to be done within 30 days. And they try and bill that as the a visit with the decision for surgery modifier. But the decision had already been made, say, a month ago. So they're trying to pay for when that patient comes in. And all they really do is take that visit to use for the H&P, and they have the patient sign the consents and they answer any additional questions. And if you read the global package, that's part of when you make the decision, you have to do all of that information. So you can't bring them back to do it on a different day to try and bill another date of service.
So I'm thinking about those who may not be familiar with global surgery coding at all. Does the OIG, do they make this update every year? Do they make these change every year that coders can come to expect?
Every month.
Oh, wow.
The OIG puts out every month on their work plan the kinds of things that they're looking at. So it is important that every month we're going out and we're looking to see. It gives us sort of a heads up on what they're looking at, so we can make sure that what our doctors are doing is correct and accurate. And it gives us an opportunity to turn the ship and correct it if they're not.
Okay. The list of what is included in your article is much smaller than the list of what's not included. Is that normal?
No, and if you read it from the actual NCCI manual or the global booklet, it tells you that this is not an all-inclusive list, that you still need to be aware of what's considered to be included. So obviously, when you go to do surgery, you're not going to bill for the making the incision to open the patient. You can't bill for the closing of the patient. You know, there's a lot of stuff that's just integral to when you perform a procedure that you're not going to be separately billable for. And it's kind of, I hate to use the word common sense, but kind of a common sense thing that you shouldn't be trying to part these different things out and bill for those services individually, because it has to be done to perform the surgery.
Okay, all right. Myra Simmons says, I think this is from a discussion just a minute or two ago. She says modifier 57 will not work. But you guys in your in the article at the near the end, it talks about making the most of modifiers and how you can use each modifier. You got modifier 24, 25, and 57, just showing how they can be applied in these situations. Is
Modifier 57 has its place for sure. We see it a lot in cases where it is an emergency situation and we had to evaluate the patient in order to go to surgery. But yeah, in the example that Angie gave, it's not going to work. The decision was already made a month ago. Totally agree, Myra.
Yeah,
So
so you
is
might see that more often when a patient goes into the ER. So a patient goes
ER.
into the ER with abdominal pain and needs to have an appendectomy either right there and then or the next morning, or a cholecystectomy performs. They're just it's those types of situations where the provider has to evaluate the patient, make the decision that they do need surgery, and they take them either same day or next day.
Right.
And then some
Right.
people forget too in orthopedics that fracture care is a 90-day global period. So modifier 25 is not your code. So the patient goes into the office because they fell and hurt their arm, and the physician evaluates them and determines they need fracture care treatment, and they perform a reduction right there in the office. That even though it's in the office, that's still modifier 57 decision for surgery because it has the 90-day global period.
Okay. I'm curious, you both know your surgery coding? Is that your bread and butter for both of you? Do you do a lot of surgery coding or manage that piece of the revenue cycle?
So I audit, and I audit a lot of E&M and I audit surgery. So I actually do both.
Okay.
Yeah, I think it's part and parcel of what we do all day, every day. I don't do it as much hands-on anymore, but a lot of auditing and a lot of educating on it.
And it seems very complicated. We're talking about inpatient, a lot of it. And or is it, I guess it just depends,
It's
inpatient,
both.
outpatient, just both. Okay. All right. And it sounds like there's so many pieces to that. What is it like for a surgery coder? I'm assuming that there are probably those who specialize in that specifically.
Definitely, there are those who specialize in it, and there are so many different specialties and so many different types of surgical services. It's all about, though, understanding your operative report and then applying the guidelines that are in your CPT code book to what the providers have documented. And I don't mean to make that sound simple, because it's not, but if you follow, there's just a step-by-step process. What are we going to look for? How are we going to attack it in our coding books? You can make it more simple for our new students who are coming in. They're learning everything. They are touching every single kind of coding that's out there. But the real world is that you get into a practice, or you get into an environment where you're focusing in on just these few specialties or these few services. So it's easier than we think that it is. And I don't mean to say that it's easy, because it's not, but it's not as complex and overwhelming, and I'm never going to get this.
I was
Yeah,
gonna
where
say,
you have to code
Sometimes.
tell that to my
everything.
students when I do the cardiovascular section.
Chapter
I
8.
tell them the same thing.
I'm like, hang in there. When we get to digestive, you'll feel so much better.
Yeah, that's good. Anybody that's listening out there,
Mhm.
just, you can make it through. If you're in the middle of the course, hang in
Yes.
there. Yeah.
I think the thing too, maybe to say to those that are watching that maybe are not familiar with what global is. So you can Google CMS global. There's a global booklet. So it's a PDF and a MedLearns Matter that they can review. Also, I would recommend, if you just go to Google to get there quick, you can do CMS NCCI manual. A lot of even seasoned coders don't know that exists, and that talks all about bundling, what's included, what's in global, if you perform two procedures together. And of course, it's not a end all be all, it doesn't have every single combination out there, but it's got a lot of the common ones. And I think that would be very beneficial place to start educating yourself.
I think sometimes we do it so often, all day, every day, that we forget some of the basics. And it's a good thing to review once a year.
Yeah,
Just make sure that we're looking at it and see what's changed and see what's different. Like I said, we actually did have global days change for one of the big surgical procedures that a lot of our general surgeons do changed last year. So it's a good thing to make sure that we're reviewing to make sure we're capturing appropriate reimbursement for the work that our doctors are doing.
El Canal asked, where can we find that list of what the OIG is looking for? Is that on the AAPC website, or is there a direction in the article about that?
You can just Google OIG work plan and it should come up. I can't remember if we linked this month's or that was November when that one came out, but it comes out every month and you can just search. Let me see if I can find it really fast.
I'm looking at the very bottom of the article. There's resources. So it has global surgery data collection, review post-operative services provided by or in the global surgery period. I don't know if that is any of that, you guys.
Oh yeah,
But-
there is links there. If you hover over the third one, it's oighhs.gov reports and publications work plan summary.
So
yeah.
you're in
So
the
even though you
article on
don't
the
see the
website.
physical link, if you hover over the active version of it, it'll take you to it. It's an interactive link.
And Alex,
Yep.
yeah, I just dropped it into our chat if you want to drop it into the Facebook chat.
I got it, and I'm dropping it in right now. All right, there you go. Hopefully that helps you out, Elle. All right, guys. Well, thank you so much for sharing this article. I love to see the collaboration, and it's cool to see your guys' history. You know, just friends met at HealthCon, and it evolves into Ville instructor buddies. Sharing a TA right now, and now it just continue to share and to help our members with the knowledge that you have.
I remember when I met Angie so many years ago, I was like, wow, that's cool. I want to be on the NAB one day.
And here you
Here I am.
are. I was so excited when I found out Missy was on the NAM.
That's
She's
cool.
got a lot of valuable information to share.
Yeah,
Yeah,
our
and
And
members
we
will
do
get
have
a
a
lot.
follow-up article. I think it's coming out in April with
Yep.
the assist and the co-surgeons with surgery. So it's kind of like our article was a little too long. So, you know, we had a little
Part
too much
two.
information to share.
Nice. To be continued then. I like that. And then also HealthCon coming up.
HealthCon. I'll be
Well,
speaking
speaking
at
of HealthCon.
HealthCon. I think Missy will be too.
I'm on one of the panels at HealthCon.
On the panels.
I'm on the auditing and compliance panel at HealthCon, and I'm doing a virtual cafe as well.
And then
Nice.
obviously you want to meet her because she's a current NAB member. So you know it's always important to meet your NAB representative. So look for her.
Angie, what are you presenting at, or what's your topic? at
Me,
HealthCon?
I'm presenting on being professional in what you do. So how to showcase the professional and professional auditor is what I'll be speaking on.
Awesome. Okay, we'll look forward to that.
Look forward to
And-
seeing you both.
Yep. Angie, thanks so much for being with us. I asked Missy to stay on with us as we talk to Melinda, but Angie, we'll see you in a few weeks out in
No
Orlando.
problem. It was
Nice
great
and
seeing
warm.
everyone. Bye.
See ya.
Hey,
All right. Okay. Hey, Missy, thanks so much for sticking with us for a little bit. We'll talk to Melinda about her Get Strategic with Your Coding Quality article. But
Sure.
well, as we bring Melinda in, would you tell us a little bit about your experience in Salt Lake meeting with the new National Advisory Board for the first time?
we have an incredible national advisory board coming in. We got such diverse backgrounds and such diverse viewpoints. We are in such great hands. We've got a lot of things that we put onto the roadmap that we want to work on. And we just had a lot of fun together. The whole board just sort of gelled and jived. Most of us knew each other from kind of out and about, but hadn't really sat down to collaborate the way that we did over the weekend. So really good experience. Looking forward to the next 3 years.
Awesome, fun. Thanks for sharing. And
Well,
we've got
did you do
Melinda.
And getting to have dinner with you.
Yeah, it's good to be with you, Missy. Melinda, how are you?
I'm doing well, thanks.
Good. So, Melinda, you are not on the NAB, but you are you are on the staff at at the national office. Tell us a little bit about yourself and what you do at AAPC.
Well, I'm the director of coding services. AAPC has so many different branches, and my branch is the coding services branch. And our department offers outsourced coding services, and we do both facility and profi, in and out, home health, hospice, pretty much any type of coding, production coding lands in my department.
Okay. So I'm sure you see great, just thinking about your article, coding quality, do you see bad quality coding coming through from those that we consult with and that you have to clean up?
Well, we work hand in hand with the audit services department. So a lot of our coding customers come from the audit services department. So they might sign a deal with us to be audited or have their coding audited or their providers audited. And based on the results of those audits, they might come to us for coding services. We can supplement supplement their services. We can, completely take on all of their coding. We've seen where some practices have transitioned from their physicians doing their coding to having us do their coding, which to me makes sense because physicians don't necessarily like to do the coding part of their job. They like to take care of the patients and treat the patients. So makes sense. But yeah, we don't necessarily see bad coding in my department. That's more in the audit services department.
Okay, all right.
Melinda,
Well,
do you only work with providers in Salt Lake or do you work with providers nationwide?
No, we're nationwide. Yep. All over.
It's a
and you
huge
talk,
value.
yeah.
Sorry, Alex.
No, that's all right. Well, Melinda talks about bringing your A game into your coding quality. And as you see that, as I read that, I think about accuracy and making sure payments and reimbursements are happening. And I'm sure you use this with your own team, Melinda. Share with us a little bit about coders bringing their A game.
Yeah, so it's a process, coding as the ladies mentioned previously, and I was kind of listening in on their discussion a little bit that it's not an easy job. It's really not. It's a very difficult job, and it takes a lot of experience, time and experience to really become a grade A coder. But our coders, we have pretty strict audits being done on our coders and their work that's being performed. But the key thing is not just auditing, but providing that feedback loop back to them, so they can learn from whatever it is that you found and then implement. And then you need to re-audit again after they received that feedback and implemented whatever it was that you were trying to correct or have them do differently. So yeah, it takes a lot. In with this article that I wrote, getting strategic is more from the practice perspective or business perspective. If they're thinking about maybe implementing some sort of quality program, or thinking about even outsourcing or supplementing their coding or whatever, some different tips that they need to think about from the business perspective, in order to have that quality coding or coding service, whatever it is that they choose as an organization.
Okay, all right. So operationally, more bigger picture.
Right. Yep. Exactly.
Okay. Well, let's look at each one of those. So understanding the stakes.
Yeah.
What should a facility know about that?
Well, I think anybody that works in healthcare should, if they're not already aware, they should be aware of what the stakes are with poor coding, denials, loss of revenue, red flags, getting audited. There's so many different flags. You can't just expect somebody without any kind of specific coding training to come in here and be a really high quality coder. So organizations really need to understand that it's not just, a back office task anymore, where years ago it used to be, whoever was scheduling the appointments or working at the front desk or whatever would just slap some codes on and be done with it, because it wasn't really as big of a deal back in, say, the 80s and 90s. Where now everything is completely scrutinized. So a lot at risk. Organizations definitely need to understand the risk involved, and the importance of having a high quality coder or coding team, department, whoever they choose to have their coding done.
I was gonna say it starts at the front desk. It doesn't start at the coder in the back. It starts with the front desk making sure that the patient is assigned to the provider, knowing what the correct insurance is, knowing if what we're going to do today is something that's going to be authorized by the insurance. And every insurance company is different. So it starts with the person sitting at the front desk who's validating the insurance.
Absolutely. And taking that one step further, with a lot of the EHRs nowadays too, that front desk, when they schedule that appointment, sets the template for the physician for what they should be documenting during that visit and whatnot. And so they kind of set the stage already right at the scheduling for the provider's documentation.
Yeah. Well, I think about the compliance piece of that, and
Mhm.
like a facility could be putting themselves in legal, I mean, because there are legal ramifications as well, right? It's just not reimbursement and things like that, making sure payments are made, which are important, but
Right.
you need to be sure that you're following the right policies, and so you're not hit with any kind of legal matters as well.
Yep, that's correct.
Yeah.
Absolutely.
Number two on your list is investing in training and education, and that's very timely with HealthCon coming up. Melinda, share your thoughts on why a facility should invest in their revenue cycle staff.
It kind of ties back to number one. Actually, that your credentialed coders go through a really intense process to get credentialed, whether it be a CPC or a more specialized credential, whatever it is, they really get put through the ringers to earn that credential. They have that experience. They know the laws, the guidelines. They might not necessarily know each payer specific contract, just, and every state is different or can be different, but they're going to know, they're going to have that foundation, which is so important, tying back again to your comment about compliance. So, it's going to help keep the organization out of trouble, and also maximize, the revenue and everything else that comes with having high quality coding.
Yep.
Our
Gotta keep your
education never stops. That's
Yeah.
why we have to have CEUs, because it's constantly, this is an ever evolving industry. It's constantly things that we have to stay on top of, but that's what makes us valuable to our providers, because we have that expertise and that experience.
Yeah, and there's updates all the time. There's updates that used to be, once a year for each, ICD and CPT, and now it's not. So there's updates, changes all the time. The coders really have to stay on top of it. So making sure that you allow your coders time to keep up with things, and not just have their nose to the charts that they're coding or whatever. Give them some time in their day to stay updated is really gonna make a difference.
We have a few questions that have come in on the chat that are not relevant to this, but so I want to just jump to one of them, then we'll hit a few more of the 7 points, and then we'll hop back to another question. But Lorraine Hasty asks, I've been certified for 10 years, CPC certified, and she'd love to work as a coder, something she's never done. She's also a dental hygienist and RN. So, wow, lots of healthcare there. How would you guys recommend that she get her foot in the door in a coding position? Any thoughts on that?
I would say, you know, even if at your place of employment that you currently work as a hygienist or an RN or whatever, if you can, you're already, you know, a solid employee at those places, if you could talk to their HIM department or their coding revenue cycle department, wherever their coding is housed, you might ask if you can job shadow, if you can, you know, maybe somehow code a few charts in that way, just to get some of that experience underneath your belt.
To show interest to them, right? Just to say, hey, I'm here. I want to go down this road.
Exactly.
Right, absolutely. I have this
Exactly.
credential. You're very marketable, especially with the RN background. I mean, there's a place for you in like CDI, you know, outpatient CDI or inpatient CDI even, you know, just having that nursing background, you're and a CPC, you're extremely valuable.
You're very marketable. That's a lot of what we see coming out into the market right now. Somebody who wants both of those pieces of experience. But just like Melinda said, it's putting yourself out there and saying, hey, let me do this. Let me try this. Let me show you what I can do.
Yeah.
That's how a lot of people end up getting their jobs, is they start at, you know, it's starting at, I don't want to say the bottom, like there are no small jobs, but it's starting at the bottom and starting to build yourself up. That's how we all got there. I started filing in the doctor's office.
Yep, internship. That's how I started.
Yep.
Dave,
Free labor.
Dave, what do you have? What advice do you have for our friend Lorraine trying to break in as a coder?
Yeah, I love that. I was actually just looking back at her comment there, Lorraine, and just to echo what these other two ladies have said, if you're already in an environment where you can show some interest and kind of get your foot in the door, or just ask some questions, go find out whatever facility you're at, go to your coding offices or wherever those people are, and just kind of maybe pick their brains and see if they're enjoying what they're doing, because I mean it is different, right? It's a different type of, takes a whole different type of mentality, and I don't know. But
Yeah.
like the ladies were saying, definitely use that experience as an RN, a dental hygienist. I mean, you've got all of this great knowledge. You've seen all of these things. Now it should be really easy now to connect the two and code them. So
I was just talking to somebody over the weekend who has an individual in their organization who is showing interest in X in this other position. They didn't have a spot open like that, but as soon as that spot opened, what was the first name that came to her mind? The person who's been showing that interest. So it's about making sure that people know what you want to do, what you're interested in, and putting yourself out there, which is really hard to do. It's hard to put yourself out and go, hey, how about me? But it's really important that we do that. That is how we grow and evolve in our careers.
And it ties back to what you guys were talking about with networking and how you guys met each other at HealthCon and all that. Really, a lot of jobs, a lot of coders, even coders that I hire are networking, that they've put themselves out there. They've messaged me on LinkedIn, or so their name is fresh in my brain when I'm looking at applications and things like that. It's really getting out of that comfort zone. And trust me, I'm an introvert, so getting out of the comfort zone is really hard for me as well. Like doing this social thing is really hard for me, because I don't like to put myself out there either. But you have to, in order to land that first coding job and get that experience that you're looking for.
well, you're doing great. I was gonna ask if you wanted to take my spot every other week and co-host with Alex. So
Dave, no.
could have fooled me.
You know, I had somebody who came to me at a chapter meeting. Going to your chapter meetings is super important for that networking. And this is one of my favorite stories, because I remember I had a former student who came to one of our chapter meetings, and she said, I'm still looking. I haven't found a job. I'm doing all the right things. And then she went and she sat down. And about 5 minutes after she sat down, somebody else who I knew from the chapter walked in and said, I just had somebody quit today. I'm desperate. Do you have anybody who can help? And I'm like, yeah, Amy, meet Barb, Barb, meet Amy. Barb and Amy to this day still work together.
Wow.
So it's about putting yourself out there and letting people know. And believe it or not, I'm an introvert too. I know you're going to be surprised to hear that, but I am.
Actually,
Don't
a
look
lot
so.
of people in our field are introverts. They want to be behind the scenes, in that back office kind of setting where they're not face to face with patients, doctors, whatever the case might be. There are a ton of introverts in our field.
Love the detail orientedness with the task oriented type of problem solving, being able to kind of think through and grind through those things, right?
Yep,
Yeah,
Yep.
absolutely.
very much
Hey,
the demographic. Yeah.
oh, for sure, for sure. Lorraine, I hope that gives you a few thoughts on how to open that door further and utilize your CPC certification. Just get out there, make contacts on LinkedIn with
Do we still
coders in
have
the area.
do we still have career counselors, Alex? Do we still have
We, I think
people
they
like
changed
that?
the
Like
names, but yeah.
even
You
reaching
could,
out to the office and
yeah.
seeing, who you could talk to there, who could maybe, I don't know, maybe get you set up with maybe Practicode or some ways that you can kind of
Yeah.
kick off some of the rust and get coding a little bit, see if that kind of lights that fire again. Sounds like it might be something that might be good.
We also have the mentorship program, which is free to members. If you just Google AAPC mentorship, you can, if you're a member, which you are, if you're a CPC, then that would be an awesome way. Build a relationship with a veteran coder, and they can help give you some guidance. So we
And
have another.
I'll
Oh, go
throw
ahead.
I'll throw one more plug out there for the Emerging Leaders Program. So we're just graduating our emerging leaders and starting a new program, but definitely something if you're looking to become a leader and you're looking to become more involved, then that's something that you'll want to start looking for December, January of next year when the applications open again, because that's another fantastic program free to members. And it's, one Saturday a month for 2 hours. There's some work and there's some projects, but we've seen some great growth in the students who've come through that program. So
I love it. I love it. We have a great question from Tanya Brown. We're going to come back to you. Tanya, I'm just mentioning this, so you stick around with us and we will discuss that. But going back to Melinda's article, helping out facilities with their coding quality. The next bullet we have is leveraging technology. And I think about things like Codify and their audit tools like Healthicity. Tell us a little bit about technology.
Yeah, technology is crazy right now. I mean, you can't go anywhere without some sort of advanced technology. Encoders, Codify, even us, AAPC, we're working on developing, putting Codify on steroids, basically. It's going to be amazing. And I can't wait for Codify 3.0. That's going to integrate some AI technology where you can, type in more than just it's going to be more than just a code lookup tool, but it's going to be awesome. That's all I can say. I can't wait for our development team to get that ready to go. But that'll help increase the time that your coders spend, or I mean decrease the time, sorry, I said that backwards. You know what I meant. Decrease the time spent looking up codes and researching, all of the references and resources will be right there at your fingertips at just a click away, so they can look up those CPT assistants and coding clinics and whatever, much faster. AI is that's the big talk in the whole country right now. Everything has got some sort of AI into it and integrating with it. The only thing that I caution is that AI is probably only as good as it is trained to be. So just be careful. Make sure if you are going the route of AI, make sure it's very well vetted and that there's been actual credentialed coders that have been doing the coding validation to make the tool work.
AI will not be replacing your coders.
that's exactly what I was just about to say.
Yeah, no, I don't think so. Coding is such a complex topic. There's so much human logic that has to be involved because coding is just not black and white. there are black and white, some pieces that are black and white, but there is so much gray area that just requires human logic to decipher that I don't think that any type of machine can be built for all the complexities that coding has in the US.
They said the same thing about EMRs when EMRs first came out, and you're not going to need any coders and you're not going to need any ability. Our system's going to take care of everything, and we're all still here and 300,000 strong.
Right.
AI is not going to go away. AI is going to transform some of the things that we do in this industry, but it's going to help us. It's not going to replace us.
Right. I like to think of it as another tool in our toolbox.
Yep.
You know,
Absolutely.
We're going to take one more bullet here, number 4, and then we'll get to Tanya's question. Number 4 is build a strong audit program. Melinda, you talked about auditing and AAPC's role with helping facilities audit. Tell us a little bit about a strong audit program in a facility.
yeah, every facility should have some sort of audit program in place. If they don't, you should probably get one. And the reason is because, you know, you don't know that you're doing something wrong until it gets pointed out to you in some way, shape, or form. And you'd rather have it be pointed out to you by somebody you're hiring to audit you or by somebody internally to audit you than, say, the government or the payers auditing you. So it's best to find out beforehand, get that education done and clean up your coding and, you know, clean up whatever it is that was found on the audit before somebody outside finds it for you.
So would
And
that
we
be,
know what they're looking at. We know what the government specifically is looking at. It goes back to the last conversation that we had about the OIG work plan.
Exactly.
Yeah,
You know, start with the low hanging fruit and then go from there. Sorry, Dave, go ahead.
oh no, it's okay. I'm just curious about because you're talking about forming, you know, an auditing program within your organization before, you know, things get audited outside or whatever. Would you are you suggesting that teams go through like their own QA process? Does that already happen in a lot of organizations where people are checking each other's coding like that? Is that part of what you're talking about?
Yeah, kind of. I mean, every organization is different, and every organization should have a compliance plan that includes some sort of auditing. And
Yep.
and there should be multiple levels of auditing, like audit your auditors, audit your coders, peer audits versus external audits. It's always good to have both internal and external audits. Just because you know, all of us coders, we all follow the same rules and guidelines, right? But we all may interpret those guidelines very differently. So within your organization, you want to make sure everybody in your organization is on the same page of interpreting those guidelines as well. And then the outside auditors, the external auditors can, you know, they can follow your internal guidelines that you've collaborated on and have set in stone for your organization, but they might also find other things that, you know, fresh eyes, a set of fresh eyes is always good to look at anybody's coding, anybody, anywhere.
Yeah. But it is common to have roles like that where people are checking other code or auditing stuff like that within the organization that aren't necessarily auditors themselves. They're just other coders, part of the team helping out. I guess that's what I was.
It
Yeah.
can vary. Every organization is different.
Yeah.
It definitely happens. Just look at our Facebook page with people asking questions. Hey, someone looked at my coding here. Here was the situation. Did I do something right? Or are they correct? This is how they're interpreting this policy. Can somebody help me? We see those questions on Facebook all the time. So we know that those audits are happening. It's just a matter of how they're happening in each individual instance.
Right.
Well, that makes sense. Yeah. Just
Hey
curious.
guys, we're gonna kind of speed through the last 3 because Tanya's question is gonna ignite discussion, and we're almost out of time. But 5, encourage collaboration across teams. 6, measure and benchmark performance, and 7, incorporate offshore and onshore resources strategically. So if you are a coding manager and to want to elevate your facilities game, excuse me, take a look at Melinda's article in AAPC, the magazine, the March edition on page 18. Melinda, thank you so much for sharing that. And sorry, I'm rushing us through the end of your article. I'm going to talk about Tanya real quick. Tanya said in the comments she would love to be involved more, and I'm assuming she's meaning with AAPC more. She is a coder. She has her CPC and COBGC, so she sounds like she's very experienced if she's had that specialty added to her list of credentials. She started out as a checkout girl at a facility, it sounds like, but what I could see Tanya being on AAPC Social Hour sometime talking about her expertise, and just like you guys are, what advice would you give her? What is that next step to be more involved with AAPC, to share your expertise and knowledge? And I'm gonna start with you, Missy.
Local chapters. Talk to your local chapter. Become involved with your local chapter. Volunteer to speak at your local chapter. I heard you say that she's got her CPC and COBGC. Hit me up on LinkedIn and let's talk. Maybe you and I can partner together to do an OBGYN presentation somewhere. But getting yourself out there and starting to speak and starting to kind of come out of our shell helps to get our name out there, and then we start to get more involved.
Melinda, thoughts on your end, Melinda?
Yeah, I echo everything that Missy said. And it goes right back to our other discussion too, is just everything is breaking out of that shell. All of us introverts have it, and we just need to kind of crack it a little bit at a time. And then before you know it, you'll be on Social Hour with Alex and Dave.
I'll even, if you're not comfortable speaking in front of people, which is okay, because we're all introverts, maybe take something that you're really passionate about, something that's coming up in OB-GYN coding or something that you see, and write an article. I will tell you that the folks that do the editing for the article, they do a fantastic job of taking anything that we've written and making us sound really smart. No. But making it flow, making it flow a little bit better. And put yourself out there that way. That lets you contribute something back to the organization and to our membership as a whole. And it starts to kind of build you up a little bit.
And it builds your confidence. Just having an article out there, it's like, whoa, look at me. I'm in a magazine, even though you're like, oh, it's just me. Who wants to read about stuff I write about? It does build your confidence and maybe takes you to that next level where you'll be ready to speak at one of your chapter meetings or become a NAB member, down the road. It's taking those baby steps.
I had an article once that was the cover of one of the magazines, and I'm at my mother's house right now, and I just found it on her coffee table. It's like 6 years old, and it's on her coffee table.
Are you on the cover? Is that what you said?
My article is on the cover. She has no idea what it means or what I was talking about, but she has it on her coffee table.
Oh, she's got it. Yeah, she's displaying it proudly. Yeah, nice.
Dave, let's hear your thoughts for our friend Tanya. What would you recommend that she do?
Oh, well, again, just echoing the getting in front of people, it really doesn't take much. Like you're saying, we don't want to threaten you that you're going to be on Social Hour if you speak up too much or anything like that. But we definitely encourage all of our members. We really love our member engagement, engaging with members and members engaging with other members and sharing their stories. So it really doesn't take much. If you have a little bit of interest, reach out, because we'll find a way that you can contribute in a way that feels comfortable to you, whether that's an article or whether that's getting on Social Hour and sharing your story, or even just a simple little, Alex does little social video clips, little interviews of little one question answers. There's so many different ways that you can kind of get involved, even if you're a little bit shy.
Yep.
So
you could take it very far, as far as like Missy here, who is on the National Advisory Board. or just baby step your way into it. That's what I love about AAPCs. Like if you are uncomfortable or maybe new to public speaking, your local chapter is a great place to do that and get experience with that. You could like there are chapters all over the country who are looking for speakers, and I'm sure your local one as well. But and that can continue to grow that experience into the two chapter advisory board, national advisory board, and we our staff is constantly looking for those ambassadors with amazing skill sets that we can that help advise us in the background. And there's so much we could go into all of that. We don't have the time, but Tanya, the APC world is your oyster. Go for it. And I love the recommendation to write. And that really it's what you want to put into it. Because I've had people reach out and say, I want to be more involved, and then they don't, just time or whatever. But you can have it if you want it, Tanya. It's out there. All right. I'm gonna email her. She should put her email in the chat, and I put Missy's LinkedIn LinkedIn link to her. So Missy, you'll be getting a new friend today.
Sure.
I regret, Melinda, that we were sidetracked for at the end here, but I just love so many great questions, and you have such a great knowledge to share on all of this variety of information that we share.
I just have to bring you back.
Great discussions today. I loved it.
Yes. Okay, guys, we will see you in 2 weeks. It will be our last broadcast before HealthCon. I think Dave will have one on the last day of HealthCon. So it was live from Orlando. Yeah. Maybe we'll have Mickey Mouse. I don't know. I don't know who will do that.
We'll see if we can wrangle him. Yeah, just drag him over to where we're doing our event. Kidnapping Mickey. I don't know. Can I say that live on air?
Yeah, they might kick us out now if this is bad. But we will be back in 2 weeks, and just a reminder that this will be on YouTube. This broadcast will be loaded up on the YouTube and our podcast. You can search for that in your favorite podcast app at the AAPC podcast. And we will, Missy, Melinda, hang on real quick. We will log off. See you in 2 weeks, everybody. Have a great week.
Bye.